Nurse Hotline, Zara speaking.
Hi, Zara. This is Ashpreet. I was just calling to talk about like an issue that I'm having with feeling pain in my left breast. Um,
Okay.
I just kind of wanted some advice on it because I don't want to have to go to the doctors and wait there for like a couple hours for no reason. So I
Yeah,
wanted to just get your advice on that.
yeah, definitely. I can get that pain. So let's see. So you're having pain in your left breast. What would have caused that, if you know?
I'm not sure. I am breastfeeding my baby exclusively.
Okay.
Um, and I feel like I'm doing everything right. I'm pumping in between as well. Um, I don't really know why all of a sudden I started to feel this pain like over the last 2 days or so,
Okay.
and some redness as well.
Okay. So you have some left breast. So like tenderness and pain.
Yeah, yeah, tenderness and pain, and
Okay.
a little warm to the touch as well.
And okay. Sorry. And you said there was redness as well?
Yeah, just under the nipple.
Okay. Under nipple. And on a scale of 0 to 10, where would you say your pain is at?
Probably like a 6 or a 7.
Okay. And how long have you been feeling this way?
I would say the last 2 days.
Last 2 days. Okay.
Hmm.
And in the last 2 days, has that pain gotten worse or has it been consistent? And has the redness gotten worse or has that?
No, the redness and the pain have been pretty consistent. It hasn't gotten worse or better.
Okay. And you did mention that you were feeding every 2 to 3 hours and pumping in between.
Hmm.
Would you say when you are breastfeeding, does the are you right breast dominant or would you say it's fairly equal?
I've had some issues with getting my baby to latch on to the left. So he does definitely prefer the right.
Okay.
So most of the time he's feeding on the right.
Okay. So there are latching issues to the left, so the right side is dominant. And do you tend to empty out the left breast, even though, sorry, what did you say it was your son or daughter?
Son.
Your son, and is he, like if he's latching onto the right, are you still emptying the left breast?
I feel I am. I don't know if I'm not emptying it enough.
Okay.
But yeah, I am trying to pump it.
Okay. And then are you experiencing any other signs or symptoms? Like, are you having any chills or fever or flu-like symptoms?
No.
No. Okay. And so this has been going on for approximately the last 2 days. It hasn't progressed. It's been fairly stable.
Hmm.
So what it sounds like to me is it sounds like you could have a potential clogged duct.
Okay.
And it could potentially lead to an infection, but because you're not displaying signs of like the chills or fever or any flu-like symptoms, and it hasn't progressed into a worse state. Um,
Hmm.
it sounds as though you do have something known as mastitis. So
Okay.
what we want to do is, especially since it hasn't gotten worse, I would recommend kind of applying like hot compresses and just kind of um, and then kind of massaging gently to see if we can unclog that duct naturally. Um,
Okay.
I want you to continue breastfeeding um, and keeping that. And I know, it might be painful, but do try to have the left breast involved in this as well. If it is too difficult with the actual breastfeeding with your son, then I would just recommend kind of emptying out on your own at a rate you're comfortable with. But
Okay.
it is important to ensure that that breast is fully empty just to prevent any infection from occurring.
Okay.
And also, by feeding the baby with the right breast as well.
Okay.
And so I would suggest monitoring that. If you don't see a decrease in pain or tenderness, then I would strongly encourage going to your physician. I know it's a little inconvenient, but you could potentially need some antibiotics. So we just want to make sure we're on top of that.
Okay.
Do you have any other concerns at the moment?
No,
No?
I think that's
Okay.
it.
Well, if anything changes, do give us a call back and we can always go from there.
Okay.
Okay. Have a great day, Ashpreet.
You too. Thank you.